It's Sean Cassidy from the communications group here at Sagamok, and we're here with Melanie Lazarus, the new director of the Community Wellness Department at Sagamok. How are you today, Melanie?
I'm good, thank you.
Great. So, Melanie, can you tell us a little bit about yourself? We're really excited to have you here.
For sure. So, my name is Melanie Lazarus, like Sean said. I have been in the role of Director of Community Wellness now for 5 weeks, and I'm very excited to be here. So, I wanted to give everyone a little bit of a background on myself. I am originally from Moose Factory. I was born and raised there. I moved to Sudbury when I was 17 for high school. I then went into university. I did my nursing. I went back home to do some nursing up there at the local hospital. And then while I was there, I went back to do my nurse practitioner's certificate. So I am a nurse practitioner as well. I practiced for 10 years in various communities. I actually did some work here in Sagamok with Mom Wacing. And then while I was doing that, I always felt there was more that I should be doing in terms of education. So I went back and did my master's in health management. So I have that, and I also did my additional learning through the Canadian College of Health Leaders. So I do have my health executive status with them. Further, I am doing my PhD in rural health, so I can say that I do have a lot of experience in health, and I'm excited to bring that here to Sagamok. In addition, I have worked extensively with Indigenous communities. I feel like that's where I am supposed to be. That's why I went to school, was to bring back a lot of my knowledge to communities. So yeah, I'm very excited to be here.
We're really excited to have you, Melanie, and that's an extensive background. So how long have you been doing this in total then, since you graduated from university?
Well, it depends when I've had a couple of graduations, so I've been a nurse since 2008.
Well, so a lot of experience as well. Well, we're really excited to have you on the team. And just a couple other questions while we've got you here. In terms of the mental health supports in the community, what would you like to touch on in terms of what is offered in particular over the Christmas break?
Yeah. So our mental health team within our department right now, they are taking some time just to focus on their team and themselves. So what we have done in the interim has, as a department, we have reached out to our external supports, Mom Wacing, Nogdawindamin, Health Sciences North, to look at what they can support our community members with, and we developed a pathway for our community members to get the supports that they need. We have the number, and it's been shared through our social media sites.
Perfect. We'll make sure to put it right on this video too.
Okay, great. And then we have Nogdawindamin and Mom Wacing offering counseling as well. And I believe, Sean, we have the numbers.
Yep, we will post those as well.
Okay. In addition to that, our Sagamok mental health team continues to see our high needs clients and those clients who require the supports that they have been providing all along. So although they're not taking new clients at this time, they are continuing with the clients that they have been seeing.
Perfect. Well, thanks for setting that up. So we'll make sure the numbers are posted here. And in terms of COVID, there is an increasing number of cases, in particular with the Omicron virus. Do you have any advice for the community?
I know it can be a scary time for the community right now, and people are likely feeling cooped up. We are working on, communicating those mental health supports out there, should people feel like it's a lot to be taking on. In addition, we are working on having different programs trying to alter the way that they have provided services so that it can be done virtually. I do ask that community members be patient with this as we try to alter those plans and programs to meet their needs. And then in as much as we possibly can, stay home, isolate, when told to isolate, please follow the directions that the nurses give when they're touching base with you for those who are in isolation. Wash your hands, wear your masks, and I really just stay safe this holiday season.
Well, thank you for that good advice. And do you have anything else you'd like to share with the community?
I'm really excited to be here, happy to be here, and I'm excited to see where our department goes and how we can best support the community.
Well, thanks very much for your time today, Melanie, and happy holidays, everybody.
Thanks.